Welcome, everyone. Thank you for being here. Welcome to Meet Your Peers. Um, my name is Noy Frial Lopez, Executive Director of Peer Services. We have quite a bit to share with you today, including an introduction to Peer, of course, an overview of our prevention services, our substance use treatment options, including our art therapy program, and we'll have plenty of time at the end for Q&A. With regards to our learning objectives, we will learn about the different outpatient treatment options that we provide here at Peer Services for adults and adolescents, including the different levels of care, when to make a referral to Peer Services, what harm reduction is, how it can be an effective model for treatment. We'll learn about expressive therapies, specifically art therapy, and how that can motivate and support someone's recovery. Language and why that matters. And lastly, we'll learn about prevention services. Peer has been around since 1975, and our mission is to reduce the harms of substance use, addiction, and stigma by engaging youth and adults with innovative prevention programming and by supporting people on their path to recovery through holistic, evidence-based treatment. We provide services to all in need, regardless of their ability to pay or their insurance status. And we envision the future and we strive towards a community that is free from harmful cycles of trauma, substance use, and addiction, and from the stigma and systemic barriers that reinforce them. Our hope and our goal is to help people develop their skills and resilience so that they can overcome their challenges and unleash their inner capacities and really live and create their own lives. How we do that is through a holistic approach where we work not just with the substance use, but the whole person, as well as a harm reduction approach. So it's not necessarily abstinence, but work with folks to reduce their use and to do it in a safe way. Definitely person-centered, person-centered, so that we focus on the client's needs and they're sort of in charge of their recovery. It is a trauma-informed lens and asset-based. We work with their strengths. We try really hard to meet clients where they are and support them on their own unique journey to recovery. During the last year, our prevention team has touched more than 12,000 youth and families through their work. And our treatment program has reached 606 clients. There's a breakdown of ages here, but 91% of them are considered low income. We don't have a catchment area, but most of our clients do come from Evanston, Maine, New Trier, Niles, and Northfield townships, as well as north side of Chicago. Our main office is here in Evanston. We do have a satellite office in Skokie, co-located at Turning Point. We also have programming in the community, including St. Francis Hospital's emergency department, at Connections for the Homeless, and in the fall with the Cook County Courthouse in partnership with TASC. Our prevention team is also in Evanston for schools in Evanston, New Trier Township, and the Glenbrook community. Before I turn it on over to Aaron, I'd like to leave you with some stats. 2021, 107,000 people in the US died of a drug overdose. 100,000 people in the US who died from an alcohol-related cause. And 15% of people aged 12 or older had substance use disorder, but only 7% of them received treatment. And of course, low socioeconomic status is a risk factor, but there are a few treatment options for those with limited financial means. And that's why Peer is around, and that's why we do what we do. And to start off, talk about what we do is Aaron.
All right, thank you so much. I'm Erin Teggy. I'm the prevention director. I have been with Peer Services for almost 9 years now, always in prevention. I love prevention. So I'm really excited to be able to share what prevention looks like, what it is, and how we do things in the community and how you as different community partners, parents, trusted adults, whatever your title is, things that you can do to really engage in prevention kind of in your everyday life. So I think when folks first think about prevention, and can we switch the slide, please? A lot of times we all have kind of our own kind of preconceived notion of what prevention is. I think, I guess I will speak for myself. I grew up in the time of DARE. Folks, grew up with the whole just say no era. And a lot of times when folks think about prevention, that's what they think about. They think about these really clear, simple, like just say no to drugs, all of those things. And thankfully, that is absolutely not what prevention is. It is so much beyond that. It is evidence-based, grounded in data and research, and it's really exciting stuff. Ultimately, our goal of youth substance use prevention is to delay or eliminate that onset of use. But we very much do not just say don't do drugs. We really focus and work at increasing protective factors, looking at what those risk factors are and looking to decrease those risk factors at a variety of different levels. So we really do work with a variety of folks kind of at that individual level, at the family level, and at the community level, to really try and get to how we can support all of the youth in our communities to make the healthy choice to be substance-free. On the community level, we do have the benefit of working with some really great substance use prevention coalitions. So I just want to do a quick shout out to them. And if you are in either of these areas, feel free to check them out. So we work with GNCY, which is Glenview Northbrook Coalition for Youth, and they really focus on the community level substance use prevention efforts within Glenview and Northbrook. And then we also work very closely with KEY Coalition. KEY stands for Knowledge Empowers Youth, and that covers the New Trier Township area. So definitely feel free to check those out after the webinar to see some of the community level things that happen. So within our prevention department, if you want to switch to the next slide, please, we really try and cover a whole lot of stuff. And we do that through about 7 different ways is kind of the framework that we have in prevention. So a lot of what we do, whether it's for students, parents, teachers, coaches, library staff, law enforcement, whichever community stakeholders there are, a lot of what we do is simply providing information. In prevention, one of the basics is making sure that folks understand kind of the current trends in substance use and how that can impact our teens and our youth. Understanding how alcohol affects the teenage brains. How does, cannabis work, THC levels, all of these different things. So we provide a lot of information in a variety of ways, whether that's kind of your traditional presentations or participating in community fairs. We have different marketing campaigns, communication campaigns that we put out there in the high schools and out in the community to provide information, our social media, newsletters, all of those things just to kind of get information out there so that students and all of the adults who interact with students or youth have kind of that current up-to-date information. Then kind of the next level that we do is we provide a lot of workshops to really kind of enhance that knowledge, skills, and abilities of not only our youth, but those who work with youth. So some of the examples that we have might be staff trainings. A lot of times the beginning of the school year is a really big time for us to work with, all the new staff, give up-to-date information on signs and symptoms, new paraphernalia, all of those things. We have a great program at ETHS where we work with their athletic department and train all of their coaches on prevention, on signs and symptoms, how to make a referral if they have concerns about an athlete, etc. We teach Too Good for Drugs, which is a youth prevention education curriculum that's about 10 to 12 weeks long and works with middle school students on really developing their social emotional skills. So again, they can make the choice and have those skills to be able to decide whether or not they engage in substance use. Some of us are mental health first aid trainers, and so we're able to provide mental health first aid and train folks in the community on that. We do parent workshops. One of our fun programs that we do specifically with GNCY that we've done is called Taco Tuesdays, and we basically host dinners with parents and their teens and lead facilitated discussions on difficult topics, because we know sometimes those conversations are hard to have. And so we set up basically dinner time, and here's how you talk to your kids about these topics. Then kind of the next level up is we really try and provide support and, support our youth in a variety of different ways. We have some really successful youth advisory boards that we work with. So actually working with high school students so that they can give their voice in prevention, what they see the needs are of their fellow peers, and really what they can do kind of within their own capacity on prevention work. And we definitely support substance-free activities, family-focused activities, et cetera. And hopefully you can see kind of an array of the stuff that we do and all the pictures that are on the screen. Next slide, please. Then kind of the next level up, and this gets, I would say, more and more, I don't want to say difficult to do, but as we kind of move along in the prevention efforts, one of the other things that we look at is, what barriers are existing? What can we do to support kind of some of these things out in the community for prevention and early intervention services, having, access to prescription drop boxes. Luckily, most of our law enforcement agencies and a lot of our communities have 24/7 prescription drug disposal options. So, if you have unused or expired medications that you want out of your home, so they're not ending up in our landfill, in our water supply, or in the hands of someone who shouldn't get them, we have a lot of great resources in our communities. Thinking about medication lock boxes, which I feel like I should probably retitle that, because, as adults, whether you have prescription medications, cannabis products, whatever the case may be, making sure that we are locking those things up so that they're not accessible to youth. We also then kind of look at other aspects of the community, like our alcohol retailers, our tobacco retailers. Are we recognizing those businesses who don't sell to minors? Are we, supporting those businesses who are following, local laws and policies and, making sure that their products are not getting into the hands of youth? Are we, supporting schools in their alternative to suspension, really focusing on treatment instead of punishment? And this is kind of where we see prevention and treatment kind of moving a little more together and supporting, those students who might be experimenting or who might be using. Then we also look at kind of physical design. What's happening actually in our environment? I think one of the coolest examples, even though it's a very old example now, but I'm going to use it anyways, is at ETHS and the Edible Acre. The Edible Acre at Evanston High School actually started as a tobacco prevention thing. The kids were going across the street over Dodge, going into a vacant lot, smoking cigarettes at the time, because this was quite a while, this was before vaping. And as a tobacco prevention measure, the school and the community decided to take that vacant lot, turn it into an edible acre, which is a hugely successful program now. But that was actually a prevention initiative, which is
Erin, can you just say what an edible acre is?
Oh, yes. The Edible Acre is a program that ETHS has. It's a whole big garden. I know they have an orchard now as well. They've really expanded the program, but students are, learn about growing food. It gets used in the cafeterias. It gets donated to community agencies. So it's this really cool program that ETHS has for growing food and sharing the food, using the food, cooking the food, all the things that has really expanded over the years. Other things, as in prevention, as we think about physical design, vaping, we know vaping is unfortunately an issue among teens. So are vaping detectors effective? Are we looking at supervision among the buildings? One of the things that we saw happen after one of the high schools that we work with, they did an addition on their building, and it was a brand new physical space, which led to a lot of corners that students were then using to then use on school property. And so we had to then help look at that actual new physical building to see, okay, where do staff need to go? Where does safety need to be so that, we're providing that adequate supervision because it was a brand new physical space. And then lastly, one of the most effective tools that we have in prevention is modifying and changing policies. We, look at a lot of tobacco ordinances, cannabis zoning laws that we have been involved in different communities. We helped, especially with cannabis in 2020, when it became legal for recreational purposes, we did work with a number of communities in helping educate the local government on what having a dispensary in a community might mean, how that could affect youth use. We were involved in supporting Tobacco 21 back in Evanston back in 2014 when they passed those laws. We are currently looking at tobacco flavor bans so that flavored tobacco products, including e-cigarettes, shouldn't be allowed in our communities because we know that is a really effective prevention tool. Because youth who use e-cigarettes, 85% of them use them for their flavors. So if we ban flavors, we help decrease tobacco use among youth. So those are a variety of things that we do in prevention, which is really, really exciting and fun. So now thinking about how prevention impacts you or what you as, again, whether you're a parent, a teacher, a school administrator, a mental health professional, aunt, uncle, coach, whatever your role is with youth, what are things that you probably already are doing for prevention, and what are some things that you can be doing in prevention? If you could switch to the next slide, please. So one of the basic things that us as adults have to do, and me as a parent, I feel like I'm out of the loop on a lot of things, is try to stay up to date as much as possible on current trends. What is the current terminology? What are the substances that are more attractive to youth? What do you need to know on how substances can impact youth? Really staying up to date on those current trends so that you can then have conversations and talk to those youth in your life. Definitely follow us on social media, sign up for our newsletter. We try and push out as much of that current information as possible so that you have it. Supporting our youth. We really want to empower our youth to make those decisions to be substance free. And so how can you really support and have conversations to support them in those decisions? One of the things that we consistently tell youth that they often don't believe is, guess what? Most teens actually aren't using. The norm is not to use. And how do you help them understand that norming process that most people aren't doing it? Supporting them who are struggling with substance use, know where to get help, know how to support them in their own recovery, and definitely contribute to different, community networks that are supporting those youth. Again, helping increase those protective factors so we can decrease those risk factors so that all of our youth can be successful. And then advocate. Stigma is still such an issue with substance use, and really making sure you're trying to end that stigma around substance use and mental health. When we're talking about substances, we talk about substance misuse. We don't say abuse anymore. It's not an addict. It's someone who has a substance use disorder or, things of that nature, to really destigmatize, because often that stigma can be a barrier for those who might be struggling or who have questions. And definitely advocate for various prevention programming in your schools and communities, and kind of those local, state, and federal policies, which are super, super effective. We always need our cheerleaders on this topic. And so you can absolutely do your part and advocate for those things. If you have any questions or want training or resources, anything, feel free to reach out to me. My email's on there, and always happy to provide prevention stuff and talk more. But I was told I had a time limit, so I'm going to stop talking now and send it over to Christine, and she's going to share the treatment side.
Okay. Sorry, Erin and I are in the same room right now, so we have to, negotiate sound. Everyone hear me okay? Great. Well, if Erin and her team weren't successful in their efforts of prevention, the good thing is Peer Services has a very robust treatment program and offerings. and I'll talk a little bit about them. But first, I'm Christine McCall. I'm the clinical director. I've been with Peer for 10 years. I started as a therapist, and I always share this, and I think it's important to share that I came to Peer as, entering the field, and I was really impressed because of how Peer thought about treatment, thought about recovery, and that we offer clinical flexibility to practice and individualize our care. We, at that time, and it's still true today, we don't require any level of abstinence. We will help people where they're at, and that was really important to me as I was starting my career, and it's still obviously important to me today. So to begin, I'll talk a little bit about our treatment services, what they are, and then how to make a referral when you may need one. So all of Peer Services treatment offerings are outpatient. So we do not offer detox or inpatient, although we can certainly help in providing consultation into where you may seek those if you need them. So our first kind of treatment offering is early intervention. So what early intervention looks like, it's typically meant for teens or adults who've had maybe an initial consequence, maybe they're experimenting and really just need that initial education around substances and how to keep themselves safe. I just got a question from Terry Nelson. What ages do you offer services? That's a very important question. Thank you. We offer services, treatment services, anyone 12 years on up. So we, I think our oldest patient historically was in their mid 80s, and youngest has to be 12 and up. So early intervention, a lot of times we do see, teenagers who maybe were caught at a party and just really didn't understand what they were getting into. And so we'll do our early intervention treatment in a couple different offerings. We can either do individual counseling services, or we have a group counseling service that meets with both teens and their parents to provide that education. So that next level of care that we offer is SUD counseling, or substance use disorder counseling. So this is going to be for people of which that, they're past the experimentation part. Either they've identified consequences, or an outside referral source or parent has identified consequences that they have faced, and they need a closer look at what's going on. So whenever we have a new client, a new patient, we're going to start with that assessment. You're going to meet with a counselor, and we're going to talk through everything that's going on to identify what's happening. How does the substance help you? What is it helping you achieve, whether it's self-medicating, anxiety, depression, and how is it harming you? And then we're going to go through and develop a treatment plan that's individualized and catered to you. Again, just emphasizing that while abstinence isn't required to be here, we are absolutely always going to be talking about the benefits of abstinence-based support groups like 12-step, where essentially Peer's model is we want to offer everything that's out there for our clients to try and explore and come back and tell us what works and what didn't. So I often will meet with a client for the first time and suggest that they, try out one AA group. Let's talk about it. And if they come back and say, that was great, I loved it, I really connected, that's fantastic. If they come back and say, I hated it, I'm never going again, that's fine too. We're going to find a different way. Another program offering we have is our intensive outpatient program. So this is the most intensive level of care we offer at Peer. It's 9 hours of group treatment a week, at this time just for adults. And that's going to be in a group format for about 2 months. So this is for people who, they may not quite meet the criteria for inpatient, and or they're not willing to go. And yet the once a week counseling is just not going to be sufficient enough in addressing underlying concerns and providing adaptive coping skills. We also provide art therapy. I'm going to let our art therapist, Monica, talk more about that after myself. but it's a great treatment offering that's been really helpful. And DUI risk education. So anyone who's been convicted of DUI, if you know anyone in your circle, it's a very complicated process. Without support, you have to kind of navigate it on your own. We're able to help provide the education and the treatment that's required to get your license reinstated. So all of those programs I just talked about, those are our, as I would say, non-opiate related treatment offerings. We have a whole other program specifically dedicated for individuals who have diagnosed with an opioid use disorder. So anyone who's struggling with heroin, fentanyl, oxy, whatever that may be, and they've tried to access inpatient recovery and they keep relapsing and they just cannot find recovery in an abstinence-based way, then they're really appropriate for our medication-assisted recovery. So what this means is that this is treatment combined with medication. So right now, the medication that we offer is methadone. We will very soon be also offering buprenorphine and then Vivitrol, so that people who are struggling with heroin use that just cannot get off of it can have medication that will help. We have a whole other seminar about MAR. It's really in depth and fascinating, but I'll just give you a couple of pieces now, because methadone historically has gotten a really bad rap, and I can understand why. I've certainly visited and or worked, volunteered at other methadone clinics. And so why we're different is that there is a expectation and a desire from the clients and the staff that in addition to the medication you're getting to help your withdrawals, you're also getting counseling and you're also getting group support. So we do, we're going to be treating the whole condition, not just offering medication to help with the withdrawals and recovery. It's important to say right now that with our MAR program, we have immediate openings, and we accept people with Medicaid, no insurance for all of our programs. So if you know of anyone that's struggling, especially with heroin use, we can get them in same week. And it has been around for methadone has been around for a long time, and it's hugely beneficial. The other thing that we do offer is community-based treatment. So what we've noticed, Peer has been, around for a long time. We've been in the community. We have several partnerships, either doing on-site groups or trainings. And what we've noticed, especially post-COVID, is that so many of our community is struggling, but they're struggling at home, they're struggling at school, they're not coming and accessing treatment the same way that they used to. And so we really have been redirecting our efforts, particularly with teens, to provide more on-site programming. So example of this is we have partnerships with schools in which that we would have a counselor come on site once a week. And so for students that have been identified as having, early one sanction or, maybe 2 or 3 violations, then they would get a treatment and or early education from a peer staff. Why this is a successful model in school is because, one, teens don't have to leave. Once the school day ends, right? I mean, they're off, and it's hard for them to come into the clinic. But we catch them where they're at, and it's also, we're coming to the school. We're not a school staff, right? It's a confidential space. They have the ability to share and be heard without necessarily the consequences that they may feel is there with school counselors. Whether or not that's true or not, I do think that's an important distinction. So those are our treatment options. Question I had from, again, Terry Nelson, do you partner with District 65 specifically for the middle schools? So we do prevention work in District 65. We have not yet done any treatment options there. But every day we're looking at other ways to partner. There was one other question that came up. What current Skokie School Districts does peer services provide in-school education and treatment? I don't believe we have any currently, but we are, definitely open to exploring more contracts. So if Mike, if you work at Skokie School District, or anyone does, please feel to reach out and we can talk further. Okay, and then one more question, then how about I'll move it on to Monica, and then we can, we'll have plenty of time for other questions after that. But what parent permission do you require for meeting with students in schools? From Terry Webb. So that also depends on the school and the district. So that's a little more complicated of a question. Some schools have it within their their student rights and responsibilities handbook that if you have a first or second level sanction, this is the program that you will be sent to. And then some don't, and will have a consent filled out when we meet with a student. But the other thing to note about parent involvement with our teens, we always, when it's safe and appropriate, want to involve our parents. Parent education is just as important as treating and helping the team. And so the times in which we don't communicate or partner with the client is when it's not safe for that student. Sometimes they're in a family situation that's not safe for them to be disclosive about this, and or the student does not give us permission. We do need anyone above the age of 12 years, we do need to get their permission to communicate with parents. But I would say historically, most teens, if they would tell me, Christine, you're not talking to my parents, and I'd be like, well, that's fine. Let's talk about the consequences that you may have if I don't. How would your parents feel? So at the end of the day, we mostly always get consent to talk to parents when it's safe for them. Okay, I'm gonna, I think we're ready for the next slide. I'm gonna hand it over and we'll answer more questions at the end. Thank you. Oh, sorry, I have more to talk about. All right, when are referrals needed? So we all know that the demand for mental health and counseling and substance use treatment is out of control now more than ever with everything going on. If I always recommend, and sometimes we get a lot of calls from people that work other agencies or private practitioners saying, when do I refer? I've been working with a client for 5 years and they told me that they're smoking pot regularly and I don't know what to do. In those situations, I think it's an initial consult with myself, someone at Peer or someone else is important to figure out first and foremost, can I treat that substance use in my own setting? And I say that because, not that we don't want referrals, but if a client already has an established relationship in which they feel safe and trusted, it's really important that we respect that and we build upon that. And nothing is more rejecting than if you have a counselor that you trust and you said, I started smoking regularly, and they say, you know what, that's out of my scope of expertise, I'm going to have to refer you. That's really going to shut down that person. So what I recommend initially is that you reach out, you talk about what's happening to first determine, is it appropriate for me to practice in this scope, or maybe we need something more supplemental. And then of course, like if you are working with someone and they do require a higher level of care, it's not safe for them to be in treatment with your facility or yourself, then please, give us a call. Our kind of process, just to walk it through, you contact us through our main number. You'll schedule an assessment for services. This is a pretty in-depth process. Usually takes an hour and a half and includes, the interview with the counselor. We will do, typically with the initial assessment, we'll do a toxicology screen, not always, but typically just so that we can see what all is in the system and provide education. For instance, we're seeing a lot of fentanyl and tranq in many different substances that people aren't aware that they're using, so that toxicology isn't something to shame our clients, but to provide them education of like, so that they know what they're taking and they have informed consent. After that, we're going to develop a treatment plan that is going to be helpful and appropriate for that person. And if you only remember one thing from this webinar, I think it's important to remember that we, again, treat everybody regardless of their income, their resources, or insurance. And I'm really grateful and proud to be part of an agency that does that. I think that's my last slide, so I'm going to turn it over to Monica.
All right, thanks, Christine. I don't know, am I showing up? Is my video showing up here?
Oh, sorry.
Okay, yeah, thanks again, Christine, and thanks everyone for being here. My name is Monica Morris, and I am a staff therapist and art therapist. I've been working at Peer for just about 2 years, coming up on my 2-year anniversary. So excited about that. Just to kind of give a quick overview of what art therapy is. Art therapy is an evidence-based modality that combines the use of art with the counseling process. So I am also a master's level clinician. Art therapy training programs meet state criteria for counseling licensure. So in addition to providing art, we're also trained on a variety of art therapy techniques. And since I've been at Peer, I've been working to kind of build up our art therapy programming. So I've started groups for both adults as well as groups for teens. I also provide individual art therapy to both adults and teens as well. So the image that's here kind of in the background of this slide is an example of artwork that was made by an adult client. He's in his 50s and he's been coming to treatment here at Peer since 2021. And I asked him, what's been helpful about art therapy, what's been helpful about coming to treatment here, and he responded, "This is the longest I've ever been sober. My mom told me she was proud of me recently. I haven't heard that in 20 years. So this is a client who meets with me individually as well as comes to our weekly art therapy group. So I do feel that art therapy has been a helpful piece for him, not only in connecting with others, but also building a sense of pride. That's been really essential in his recovery. This client has also gone through a number of different treatment options. He's been to residential and inpatient a variety of times, lived at different long-term care facilities, as well as done IOPs. And so I think, this being kind of his first time working with someone and engaging in art therapy, I think that's offered him something different. So he has been sober for over a year now. All right, so we can go to the next slide. Art therapy is a really helpful tool when it comes to working with folks who are struggling with substance use. I think the first thing, the first benefit to offering clients art therapy is that it's a nonverbal form of expression. And when we think about the underlying trauma that often leads to substance use, oftentimes our clients are reaching for substances because they are unable to verbalize or unable to sit with the difficult feelings that are associated with their trauma. And so art therapy offers an indirect way for people to express what they're feeling, as well as slowly and indirectly explore and build capacity to sit with difficult feelings or process their trauma. Art therapy is an active therapy. Clients are not only talking and engaging and counseling, but they're using their hands, they're engaging their senses. They are an active participant who is creating during the session. And I think that leads well to the next point of visualizing change. A lot of our clients who are coming in are very depressed and may have a hard time finding hope, verbalizing hope, imagining a better situation or better life for themselves. And so by incorporating art into their treatment, they're actually able to visualize what that could look like for themselves, whether that's through drawing, collage, making vision boards. I think that's kind of a common thing that a lot of people know, a lot of clinicians have used. They're able to visualize what they want to see for themselves. They also have choice and agency. We're working with clients who are affected by a number of systems, whether that's just kind of going through Medicaid and navigating healthcare as a system, or the justice system, if we're getting clients who are referred from, due to an issue in the community, school systems. And so I think they oftentimes feel like they don't have a lot of choice and agency over the direction of their lives because of the ways that systems interfere and stigmatize that. So just giving them the opportunity to pick and choose what art materials they can use in a session actually goes a long way. It's a small gesture, but it communicates a lot to our clients.
Niggas up, man. They come out there, we're gonna get Chicago.
Oops. In addition to choice and agency, I've noticed that especially with our adult art group, I'm noticing stronger treatment engagement. A lot of clients who have dropped by our art group, once or twice, they now come regularly every week. Within our MAR program, clients come in, receive their medication dose, and then a lot of times they leave. They've got stuff going on. But I'm finding that with the art group, we have clients who come in even on a day that they don't need to get their medication, they're still coming in just to attend the art group. So I think that art just kind of offers something different, gives them something else to talk about, something to look forward to. We are exhibiting art. So this image here is an example of a community exhibition that we did. We displayed art for Recovery Month last September at the Glenview Public Library. So this is a photo of that and some examples of client art that was made here at Peer. I think this was a big deal for clients as well. A lot of times shame surrounds substance use. So giving folks the opportunity to share something that they've made, skills that they have, and connect with the community really helps foster a sense of pride and connection. And I think the one thing that we've seen when it comes to working with substance use is that connection is an essential part of recovery and healing. The last benefit here is just that this, challenges the stigma associated with substance use, and ultimately offering clients art, it helps reconnect us overall with our humanity, despite facing the stigma that's attached to substance use. So those are some of the benefits there. We can go to the next slide. All right, and who can benefit from art therapy? So I think sometimes when we think about who creates art, we might think, oh, art therapy is just for kids, or it's just for teens, but actually anyone can benefit from art therapy. I would say with my weekly art group that I run for adults, the majority of adults who come to that group are older adults, either in their 50s or older. So art can be really beneficial for anyone. So I recommend it for all ages. I also think that art therapy can be really helpful for clients who are feeling stuck or looking for something new. So if you have a client who has tried a lot of different things, but are still feeling stuck and not making the changes that they want to make, sometimes art can be a way to that challenge. And it's starting on two groups starting on the 21st and 14 age up. So if any clients might be interested in doing this group benefit from that, it'll be very alive and welcoming space. We'll have rights to give a total space. You're going to have to reach out to us. That here is our focus. So art very casual, it's 2 hours, very much so it's an open time window where clients can come and go. And I'm running that now. We just started a Tuesday morning group, so that twice. Yeah, and then I always open community doing a kind of art pop-up in our group, or even I'm always happy with folks and using and communities. So that is our art program. So feel free if you guys have any questions in the chat.
Thank you, Monica. Thank you, Aaron. Thank you, Christine. We'll now take questions. So we do the jam, just yourself. But I do take a moment to recognize all folks who participated in the role in this presentation today. That includes Courtney Clay and Stephen Hoover. They're working on that. Thank you. So feel free to put your questions in the chat.
A question, I don't, this is related, but Erin, I think you mentioned that, the takeaway that you provide these services regardless of ability to pay. I thought I'd heard, and maybe you can clarify, that in-hospital for Medicaid is problematic. Can you correct my thinking on that?
You said in, I'm sorry, you said in hospital Medicaid is problematic.
Yeah, I've been reading that Medicaid patients are having trouble accessing in-hospital care, but maybe I'm wrong and I don't.
So you're probably not, unfortunately. So we're outpatient. So we typically Medicaid and Medicare. I'm knocking on wood now, but we haven't really seen problems with the billables. But for especially Medicare clients that do need inpatient, it is really hard for them to access care because Medicare historically hasn't paid for inpatient substance use treatment.
Okay.
So what often will sometimes what we have done for patients who maybe want or need inpatient, we could see them in our IOP, so 9 hours treatment a week. Or I know some people had success, going to places like Gateway or Haymarket that do have beds for people short. But this has been a problem for a while.
Thank you for clarifying. I was just wondering if you guys had a special backdoor way to.
I wish.
Christy.
Yeah.
Thanks.
I see a question in the chat about whether our services are just for Cook County or all Illinois residents. So our treatment services are open to anyone in Illinois, and we offer both telehealth and in-person services. However, our medication-assisted recovery services have to be offered on-site in our Evanston office. But our treatment services are available to anyone in Illinois. And then Erin, do you want to speak about our prevention services?
Sure. Sorry. So with our prevention services, we're a little trickier in prevention. Our main service area is Evanston, New Trier, and Glenview, Northbrook. Because mainly we have grant funding. In prevention, we are pretty much 100% grant funded. And so those are our kind of geographical areas. However, if folks outside of our geographic area do request or would like prevention services, we're able to do that at cost, and we very much negotiate and, I hate saying no, I hate people. So we figure out how to make it work in the areas outside of Evanston Township and the Glenx.
Christine, can you look at the question from the crew in the chat? Oh, did one more answer?
It looks like it was a question from Flora. Is it okay medication to be a SMRF or nursing home and some therapy or when you go through med on SMRF? And my that clients in a SMRF are welcome to come to treatment here. They would need to go through the intake process, and then they would be able to engage art therapy in groups here. And it should be covered under Medicaid with no cost to the client. What is a SMRF? That's a great question. I think Candace Mitchell on this call can remind me of the acronym. Is she still on?
Something here. SMRF is a specialized mental health rehabilitation clinic. So, and it's based on her purpose. It provides housing and medical care to struggling with mental health issues or substance use. So, we have a couple different facilities like this here in Evanston. Two of which being Green Air and Albany. The client is residing on those facilities. They're still able to come to treatment here. They need to go through our typical intake process. We expect there's no cost, and yes, that includes all our groups, our groups. All of those things are covered.
I'd like to add also that if you any clients and SMRFs, send them to me. I'll help them however I can. I always carry peer services information. I'll help them with referrals. My favorite saying is, "It's a SMRF, not a SMUF," because they forget the rehabilitative. And so and I tell them all the time, it's a SMRF, not a SMUF. What are you doing for rehabilitation? So anybody here on this call that has any sort of this, let me help you, and let me help you peer. I want to get all of us on the same page with this.
Candace, please go ahead and your contact info in the chat.
Will do.
There's one more question about referral follow-up. For instance, if police officers are on the follow up within 24 hours with subject.
Sorry, can you repeat that one more time?
Sure, there's a question about referral follow-up and whether or not police officers wanted to first appear, would you be able to follow up with subject?
Yeah, so we do. Everyone is returned 24 hours when they call. We may be able to get them in for a next day assessment, but we do make contact with them within 24 hours.